And let's look at the slides here, and I start the slideshow from beginning. As you see, today we are going to speak about instructions and procedures. So we started speaking about this at our previous class, and today we'll continue. And first of all, I would like to congratulate you on getting certificate for online course. So we were working hard to cover all the tasks in online course English for Healthcare, and here we are. We have those students who were curious and eager to get the certificate. You just could get them. So those students who don't know about how to do this, so you may just ask your group mates about this, how to get the certificate. It consists of, there are several pages on this certificate, and there is a page with your name and the name of the course, English for Healthcare from King's College of London. So congratulations to all of you. And let us move to the next slide. Now we're going to speak about the test results. Tell me, please, are you happy with the results of the test?
Yes, ma'am.
Mm-hmm.
Yes, ma'am.
Everyone?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Good. Well, I mean that I've added some grades, some points for participation, because the test results were not very excellent. Some of the students got only half of the possible score. And that is why I'm not happy with the results of the test, but just because you were participating and working hard, that is why just I gave you just the points to get an excellent mark in English. So not everyone, of course, yes. Mm-hmm. You see that if you submit the tasks on time and if you do everything, you should, you can get the maximum score. Well, and let us look at some of the tasks that were in the test, just to analyze our mistakes, why we have chosen the wrong variant. So you see, this is the screenshot from one of the questions, and so here we have the definition for maybe definition or the sentence that we can in which we should use one of the names, one of the jobs which are given here. We spoke about this in our classes, and that is why I was surprised why you just gave the wrong answer to this task. So it says an important link between hospitals, general practitioners, and other health professionals involved in antenatal care is the who?
Midwife.
Midwife.
Oh, yes, exactly. This is midwife, because the key word here is antenatal care, right? And so receptionist, as somebody has shown, chosen, receptionist is not like a link between doctors and professionals. So he's just the person who meets the patients in the clinic. Okay, so let us look at the next slide, and here we have. So this is the question that shows us that we should be more attentive. The question asks, is the sentence correct? And the sentence is, doctors in urban areas are usually more educated than in rural areas. If we don't pay attention to the spelling, to grammar, so everything seems to be okay, right? But it's not true. It's false. What is wrong in the sentence?
Than,
Get
ma'am.
same education.
Than, ma'am. Educated
It should
than.
be than.
Yes, instead of then.
Instead of then, it should be.
Instead of than.
Yes, and we discussed this in one of our classes, during our classes. And if we move to the next slide, so this is also hard. It was difficult for us. Just practice is run by practice manager, because run here means is organized, is supervised by a manager. So I mean, this is the person who organizes all the processes, and just assign, just give a sign, give the distribute the activities in the hospital and so on. That is why we can't use general practitioner here. Well, then also the same jobs, and this person needs very good interpersonal skills, because they are the first contact people have with the practice. When the patients come to a clinic, they meet whom?
Receptionist.
General.
Receptionist.
Exactly. It's a very.
Reception.
That is why I don't know why somebody just have chosen another word. Now that were the tasks, vocabulary tasks on the Lexis, and there were also several tasks on grammar. We should have to differentiate. We should differentiate from past simple and present perfect. We were speaking about this, and here. So we have the sentence: first I, the history from Mrs. Simons, then I, her. Well, these two sentences describe the actions which happened one after another. This is a succession of actions. And when we have succession of actions like this, we should use only the past simple tense. And the past simple is which letter? The letter.
I have taken and I have examined. B.
Yes.
Past.
Yes. First I took the history from Mrs. Simon, and then I examined her. So this is the letter B.
B. Took and examine.
Yes. Well, and here we have a look at this screenshot. Well, he's not available at the moment. The case notes to make sure they're up to date. So
Check.
he's checking.
Checked, ma'am.
Checked.
He is checking.
Yes, because the time marker is at the moment. So it shows that the action is in progress now, the moment of speaking. And we should use the present continuous. He is checking the case notes. He hasn't finished doing this. We can't use have been checking. So he's still doing this at the moment. Well, the next sentence. My children with the general practitioner practice last year, but I with them longer. So we have in this complex sentence, there are two parts. In the first part, we have the time marker last year. That is why we need to use the past simple tense. The past simple tense.
Registered.
Have registered.
Past simple.
Option B.
See, ma'am, have
Option B,
registered.
ma'am.
No, past simple is registered.
Registered and have been
Sorry.
registered.
Because have registered is present perfect, right? So what do we choose?
B. D. Registered, have been registered.
I registered with them longer.
I
B,
have
ma'am.
been.
I
I
have
have been.
been registered with them
I
longer.
have been registered.
It's better to use to choose D variant.
D option.
D. So my children registered last year, but I have been registered not last year. We don't know the exact time. That is why we use the present perfect. We just speak about the result. The time is unknown here, because about children, that was last year, but about me, so I have been registered with them longer. So D is better here. And so my last class for the day, I'm going home now. So the action, so I finished doing something, right? So, and the result of the action is that I'm free and I can go home. If we speak about the result, if we speak about something, the action which has finished up to some period in the up to some time in the present, we need to use the present perfect. So that is why we need to use I have taught my last class. So this is A variant. Okay. And yes. Do you have any more questions about the questions, the tasks that you met in the test that you still don't understand? Do you have any questions?
No, ma'am.
No, ma'am.
No, ma'am.
If you remember
No,
something,
ma'am.
yes, I see. If you remember something that you don't understand and you would like to ask, please write in the chat in the group, and we will discuss this, okay? Well, and
Okay.
this is about the test, and now we continue speaking about instructions and procedures, and here there is information about how to give instructions. So when we give instructions, the imperative mood of the verb can be used. It is used to give for giving very clear and direct instructions, like do, sit down, go. The imperative does not sound impolite here, as each command forms a step, which is part of an accepted procedure that is learned like a formula. The person receiving the instruction will pass on the steps to someone else as part of their teaching. So we teach somebody, do this, read it, open, and so. And in this just direct instructions, we should use infinitive without particle to. This is the imperative mood of verbs in English. Like the example, complete the drug charts. And in the negative form, we use do plus not don't forget to complete the drug charts. Or we can also use such adverbs as always. Always complete the drug charts is also possible. Well, and if we move to the next slide, here there is one more. possible way of giving instructions to use the present simple and the pronoun you. They are used to describe steps in a procedure, like in the sentence, you wash your hands, then you put on gloves. Or also adverbs can be used, like here in this example, you clean the area thoroughly. And the negative form with you is you don't need to put the instruments away yet. So this is the present simple and you to give instructions. And let us have a look at the picture here and what kind of procedure are we going to describe. So do you see? This is IM injection. What does it mean, IM?
Intramuscular. Intramuscular injection.
And let us just think of what procedures, what instructions should we give. Don't forget that the instructions here, when you talk to your colleagues, when you teach somebody how to do something, the instructions should be short and you should use imperative mode. So what should we start with? What kind of?
Wash your hands.
Wash your hands and put on a gloves.
Put on your
Put
gloves.
on your trousers.
Then
Sterilize the area. Where you
Realize the
need
area.
okay, what else? Should we? What else should we do?
Inject on the in the correct place.
use a syringe with the medicine
Yeah.
and inject it in the area where you sterilized 90 degrees with a 90 degrees angle.
90 degrees angle.
Like perpendicular.
Yes, very
As
good.
it's intramuscular injection.
Yes, yes, it's very important. Then what is the next step?
After injecting,
After
injecting,
injecting, we should remove injection and we should throw into dustbin.
Okay, yes. This is what you say to your colleague when you teach them just how to do injections. Well, this is one of the examples. Just wash your hands, gather all needed supplies. It's very important, also very important step. Then locate or mark injection site, clean injection or sterilize injection site. Prepare syringe with medication and then inject the medication with the syringe and remove the needle of the syringe. So you see that the phrases are short, clear, without any decorations, as you say. Well, then let's move to the next slide. And here we are going to read some the article, which is called DOPS. These letters stand for Direct Observation of Procedural Skills. And so this is the article about the body which controls how doctors, nurses can just do different procedures. And these processes are supervised by the Royal College of Physicians, the British College. And here's the logo of this college. Now, before we read the article, the text, so we should focus on the following task here on this slide. So the text describes the practical DOPS, which stands for Direct Observation of Procedural Skills, on which trainee doctors in the United Kingdom are assessed. So this is the article about assessment of some activity. And we should underline the noun which you think will follow the verb in the text. To the right, we have several verbs, and there are 4 nouns just given on the same line, and we should choose one of them, which is closer to the topic of our article. Let us listen to Manish. What do you think of the first line here?
Ma'am, we need to provide the feedback, food and information data.
What do you choose? Which noun do you choose? If we speak about assessment.
Feedback.
Feedback, yes, provide feedback, exactly. Well, let us listen to Pradip, number 2.
Yes, undertake searches, procedures, service investigations. We take procedures, ma'am.
Sorry? You should choose one of the
Procedures,
no,
ma'am. Procedures.
procedures. I see. Undertake procedures because
Procedures.
I see. Okay, great. Well, Rohita, please.
Assess a theory, attitude, competency, cost, ma'am. And third one, competency, ma'am.
Yes, assess competence. Well, Bhuvanesh, number 4. Bhuvanesh, are you here? No, Bhuvanesh. So this is minus. So Hita, please.
Identify strengths, ma'am.
Identify strength in some process, in some knowledge. Okay. Well, the next person is Afnan.
Yes, ma'am. Administers medications, help business punishment.
Yes, if we speak about doctors and about assessment.
Yes, ma'am, it's medications, I think.
Medications, yes, administer medications, sure. Well, let's listen to Khadija. Khadija, number 6, please.
She's not there.
Why? Do you know the reason?
Ma'am, she has some
Ma'am,
kind of
she
emergency.
has some health.
She went to hospital, so she couldn't attend the class.
Musharif,
Yes, ma'am.
number 6.
Seek its help.
Seek help, yes. And now the last is for Mayuka.
Consider age.
Okay, possible, consider age. And if we speak about assessment of doctors,
Reasons.
Reasons.
Okay. Let us check. The answer is given on the next slide, and here we have provide feedback, undertake procedures, assess competence, identify strength, administer medication, seek help, and consider feelings. Feelings of patients, maybe. Yes. How the patient's feelings can be taken into consideration. And as for seeking help, this is like, we should remember that doctors work in a team, and if they don't know something, they should discuss this issue in a team. That is why just seeking help is given here. Well, and now let us look at the next slide, and here we have the beginning of the article, the OPS, direct observation of procedural skills. And you can see here there are a couple of words from the text that we should focus on just to make sure that we understand everything. So one of the words is trainee. It's, as you see, a person undergoing training for a particular job and or profession. We should differentiate between trainee and trainer. Trainer, this is the person who gives instructions, and trainee just listens to instructions. And another word here from this extract is encounter. And in this context, encounter means meeting or session. Now let us listen to Mayuka. Will you read first part, please?
DOPS is designed to provide feedback on procedure skills essential to the provision of good clinical care. Trainees will be asked to undertake 4 to 6 observed encounters or procedures during the year within a different observer for each encounter. The assisters include, among other experienced specialists, appropriate nursing staff or consultants in a secondary care settings. The estimated time taken for each procedure is 20 minutes. That is 15 minutes for the assessment and 5 minutes for feedback.
Is everything clear?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
If we have a look at this phrase, consultants in a secondary care setting. What is secondary care setting? And if we have secondary care, what is the first care? Who can understand? Who can help us and explain this difference?
It can be maybe a senior, then the nursing staff, secondary care setting.
And if we speak about providing this service, healthcare service, there is the first care service and the second.
First care is specialists and second care is a normal general physician.
Maybe general practitioner just deals with first care and consultants with secondary care. Or we can speak about emergency. This is the first care, and then secondary care is provided by some specialists further after the accident, for example. Okay, and let us move to the next slide. And so on my list, let us listen to Rina. Read it, please.
Yes, ma'am. Each DOPS should represent a different procedure, and trainees should choose from each of the core problem groups identified in the F2 curriculum. By the end of the year, the trainee chooses the timing, procedure, and observer.
Okay, here we have the phrase F2 curriculum. Curriculum, this is a plan, as you know. And F2, F2, this is foundation 2, foundation program 2. So they're for the second year students, for example. So, and year of instruction. The next piece of information is for Hargavi.
Yes, ma'am. What is DOPS? It is essential that all trainees should be adequately assessed for competence in the practical procedures that they undertake. Directly observed procedural skills is a method that has been designed specifically for the assessment of practical skills and was originally developed and evaluated by the RCP. In keeping with the foundation program, quality improvement assessment model, strengths and areas for the development should be identified following each DOPS encounter.
Well, so, and we have one abbreviation here. This is RCP. What do they?
Respiratory care practitioner.
You see, this procedure, this method was developed by the RCP. This is the name of the organization that I showed you the logo of. So this is Royal College of Physicians. So, and the procedure was developed by this college. Well, well, and so the next piece of information is for Lahari. Lahari? Is Lahari with us? No, minus. Manish, please.
Yes, ma'am. DOPS includes a range of procedures. For example, venipuncture, IV, cannulation, the use of local anesthetics, arterial puncture in adult, blood culture, peripheral, and blood culture central. Also included are nasogastric tube insertion and airway care, including simple adjuncts and intubation.
Yes, there are a lot of medical, technical language here, medical terms. Well, and so you understand this is IV cannulation. There are 3 letters and here, so we don't need so many. Well, IV, what does it stand IV for?
Intravenous.
Intravenous cannulation. Okay, so this is the description of the procedures which are assessed during this process. And if we move to the next slide, so let us listen to Pradeep. Pradeep, hello.
Yes, ma'am.
Pradeep, please.
Yes, ma'am. Yes, ma'am. Each doctor needs to satisfy a number of criteria, some of which are given below. Apart from overall ability to perform a particular procedure, the trainee needs to demonstrate an understanding of relevant anatomy and the technique of the procedure. There needs to be a clear demonstration of appropriate preparation before the procedure takes place, as well as knowledge of the appropriate analgesia or safe sedation and the aesthetic technique.
So here we can see the criteria that are used to assess the trainees. And so I think that is the last part of the article. Yes, let us listen to Rohita.
Yes, ma'am. Apart from the technical ability, a trainee needs to seek help where appropriate and demonstrate post-procedure management as well as good communication skills, while at the same time considering the feelings of the patient.
Also, the skills that are evaluated during this process. So I'm here, ma'am. Sorry, ma'am. There is a technical problem. This is Lahari. I see. Do you hear us, Lahari?
Yes, ma'am.
I see. Great. Well, and let us move to the next slide. Here we have some sentences just that we should complete according to the article. Which alternative in italics below makes these sentences true? Well, let us listen to Sohita. The first.
Yes. During the year, trainees are examined by the same or various assessors. They are examined by various assessors, ma'am,
Yes,
like specialists.
Yes, exactly. You're right. Okay. So, Afnan, please. Number 2.
The timing, the procedure, and the observer are chosen partly by the trainee, ma'am.
So the text says that this is done.
Solely.
So, putting on this experience. Where is it? Somewhere.
I'm in the last page, it is there. Trainees
Last
can
is
use the
trainee.
not the previous one, ma'am. Before this. Yes, the trainees chooses the
Uh-huh.
timing procedure.
Yes. The trainee does it themselves. So that is why we choose solely by the trainee. So the next sentence is for Musharafuddin.
Yes, ma'am.
Number 3.
DOPS was created or adopted by the RCP. DOPS was created by the RCP.
Yes, created. That was this college initiated these procedures. Okay, the next is for Mayuka, please.
As part of foundation program, it is expected that the weakness of each trainee is DOPS should be improved.
Mhm. You choose expected, and you are right, it is expected.
Yes.
Unfortunately, we have less than 1 minute, so we stop with the sentence number 4, and let's take 10-minute break, and in 10 minutes we'll I'll see you in 10 minutes, okay?